Dr. Seema, nowadays more and more women seem to be opting for the cesarean method of delivery. Is there any particular reason for this?
Well, the reasons are many, and the only thing is that the doctors get blamed for it, that we are deliberately delivering the patients by cesareans to make money, but the reality is not that. The reality is a mix of many factors that is leading to an increase in cesarean rates. The family size is shrinking because the women are really wanting to have only one or two children, so they feel why should they really want to go in for a painful normal labor, while cesarean can be an easier route. You can also plan a cesarean as and when you want, on your convenience. You need not really wait for the nature to give you a signal and then you go into the hospital, which might take many days, and despite that the outcome is not really assured whether you will be able to deliver normally or not. So a lot of people, especially the working class, the executive class that I would say, is preferring to have the whole process in their own hands. They usually tell their doctors that, okay doctor, I don't want to have a normal delivery, I want a cesarean, do it on this day, it is a good muhurat as well, and let's do it and let's get over with, because this weekend I'm free. That's how we usually get demands for. Second thing is that we have to accept that our modern women have not been physically very active. We've not really played many sports in our childhood. Our pelvises have not really developed. There could be a lot of deficiency because of which the pelvises generally are getting smaller, and evolution wise now babies' heads are getting bigger. So because our brains are constantly developing, the head circumference has gone up by a few millimeters over the last few decades. So you see the babies' heads are becoming bigger and the pelvises are getting smaller. So we are definitely seeing a discrepancy here. To top up with that, women are not really wanting to get uncomfortable for a normal delivery, and the threshold for pain acceptance has become very low. So they feel when they are going to have just one child or maybe two children at the most, why should they want to put themselves into all that trouble of normal delivery? And also from the doctor's side, because normal delivery is now fraught with many dangers, because you have to really monitor a woman for a longer period of time, and you don't want anything going wrong at all, because there is absolutely zero tolerance for any side effects happening. You really don't want a sick fetus coming out who would require nursery care or anything happening at odd hours. So our threshold of cesarean is also going low with the basic minimum. Anything going wrong, we rush and let's say finish it off, because now we don't want to take any chances. So everything is happening as a mix of these factors. So there are patient factors, there are doctor factors, there are hospital factors, because you may not have adequate staff monitoring the patient when you're not there. So all these factors coming together is going to give rise to an increase in the cesarean section rate these days.